Today we're going to take a quick look at periosteal pecking and how it can actually be used in your clinic. I use it quite frequently. It is primarily to address the sclerotomes and have a segmental effect, but mainly what we'll look at today is to how you can use it in your clinical setting. I use it to address quite a few foot problems, particularly ankle, where I may well periosteal peck in and around the lateral malleoli, and that will allow me at a later stage to be able to come back and mobilise that particular joint where you've got somebody with subacute lateral ankle sprain. So it's something you can actually do in order to come back to ease pain and discomfort in preparation to mobilisation. Also utilise it on things such as the hallux in order to allow pain and discomfort, particularly when somebody's got something such as hallux limitus. So again, quite effective on those particular conditions, and particularly when they've got problems along the met shaft. You can also use it with things such as your tennis elbow, where you can periosteal peck in and around the lateral aspects of the elbow joint in order to ease pain. So let's take a quick look at how that can actually be done within your clinical setting. So regards to periosteal pecking, what we're mainly looking for is one of the bones. So what we're going to basically do is to come down and peck onto the shaft. Now what's going to be most important is to try and ensure that when you peck, don't go straight down at it, otherwise chances are, if you look at the shape of the bone, it narrows as it comes to the top, so chances are you may well miss it. I always say come to the side and peck at it that way. Same again with the hallux, you can peck into here, and that's quite good for hallux limitus, so you'll be coming in these areas here where you've got restriction in mobility. The manner in which it works is through the sclerotomes, so it's more segmental acupuncture. So what you're mainly going to find is it's going to override signals going back towards the spinal cord. So on average, effects may well last for several days. So if we take the needle, ideally it's to use around about a 30 gauge. So I'll do it onto the shaft of the first to start with. So what we're going to basically do is to find where it's close towards the surface. We're going to come down. Now we can actually get that onto the bone. So we're just going to do some very short little pecks onto that. That's more sensitive. And then we come out.
Really? Just like that? Just slap it and then come out?
Yeah, that's it. Now you have got your other points that we can actually do. Normally you just get a dull ache from this. You don't normally get a sharp pain. So again, if I'm going to do the met shaft, and again I use this quite frequently, if there's any stress fracture along the met shaft, or if there's any pain, discomfort along this way. But as I was saying beforehand, what you want to basically do is to come at it from the side and don't come at it straight down, otherwise you can end up missing the bone. Push firmly up against the bone. And again, just tap him in. Okay, couple of pecks, and then you're going to come out.
Suppose you're stabbing the bone a bit.
So what we're basically doing is coming onto the bone just in that manner, yeah? And it's anything between 2 or 3, 5 maximum pecks, and then that's it.
Why would you be doing this? Just for...
This is mainly to stimulate the sclerotome. Yeah. So key thing is
bone
when you can do it for enhancing bone healing. You can do it mainly on a pain basis, particularly if you've got things such as medial tibial stress syndrome. That's been shown to be more effective than ultrasound. Is your periosteal pecking. Where you've had cases of heel pain, periosteal pecking, the calc has been shown to be more effective than administering a cortisone injection.
Okay, so you just peck the actual calcaneum.
Yeah, so you're going to peck the calcaneum. I do see colleagues where they'll actually go into this manner here, where it actually goes into the insertion point. Now, key thing that I do say about that is your biggest problem is if you are going into that section there, it's the insertion. And where you're going to get any insertion, like the apex of the patella, when you go into those insertion point, it's soft. So your needle is going to be going into soft area of the bone, a very sensitive area of the bone, yeah? And you're going to have some nerve endings and things like that, so the patient might find it quite painful. Again, you can go so far into it and then find it's going to start sticking and have a bit of difficulty getting the needle back out. So to have periosteal pecking, you can come in from the side. It'll have the same effect. Yeah. So what you're going to basically do now is, instead of going into the insertion point, here, you can come into here. Yeah, and have the same effect. The whole sclerotome in that region is going to affect the same segment of the actual spine itself. Yeah. So physiologically, you're going to have a similar effect. Pain-wise, you're going to have a similar effect. As long as you're on the same sclerotome region as what the actual pain is in, then it will have a same effect. So that's going to be in and around L5. So therefore, at that segmental level, it'll have an effect on L5, which will be similar to where the heel pain is.
With medial tibial border pain, because it can be all the way up the tibia, so would you go and pack all the way out?
I'd find the closest point. So if that's your key area of pain, then what I'd mainly do is to just find the closest point to it and peck into it. But I wouldn't necessarily peck directly into the pain itself.
No.
So that's pretty much what we do. Well, thank you for watching today, and hopefully you found that helpful, and hopefully you can go in, put some of that into practice. If you wanted more information, particularly on how we utilise acupuncture, you can go to our website, which is stevebailey.acupuncture.com, and there's plenty of online training courses there, webinars, or even workshops that you can register yourself onto. So I do look forward to seeing you again on some of our quick, short presentations that we provide for you, and hopefully that you will actually find them useful. Thank you for listening.